Okay, and with that, I'll go ahead and turn it over to Erin.
Good morning, everyone. Welcome to day one of our Advanced Prevention Institute, Amplifying Expertise and Connection of the New England Prevention Workforce. We are going to be together for the next 3 days from 10 to 2 p.m. We kind of set this up to where you can choose which sessions you want to go to. It's going to be in the same Zoom link for the full 3 days, and you can pop in and out as your schedule allows. If you attend the entire institute, that's going to be 12 contact hours for you, and you will receive a certificate of attendance for participating. So for those of you who are prevention specialists and certified through ICNRC, you can use this towards initial or recertification. And then I just want to go over some kind of welcome slides with you, some logistics, and I neglected to put a slide about the certificate, so that's why I just went over that piece. But as always, if you have any questions, feel free to message me in the Zoom chat. And I wanted to get started today with a land acknowledgement first and foremost. The New England PTTC acknowledges that we are all on the traditional lands of Native people. In Augusta, Maine in particular, where we work, we are on the ancestral lands of the Abenaki people, part of the Wabanaki Confederacy. We have a responsibility to acknowledge our Indigenous connections and the histories of Indigenous land dispossession. We encourage you to learn more about the stewards of the land you live and work on by working with your Native neighbors and by visiting nativeland.ca, which is a wonderful resource that I feel like most of us are familiar with now. But I did want to highlight some great resources that are on that website that can just help you learn more about why we use territory acknowledgements and how that's really just one small part of disrupting and dismantling colonial structures. And so I find that just kind of looking through these resources and learning more and educating yourself, you can really go outside of just putting a land acknowledgement in your presentations and really go beyond that and learn more about why we do it and what it means. If you have any questions on that, I will actually just put that resource in the chat when I'm done with these intro slides. So that way after today or after the 3 days, you can do a little bit more research for yourself. And the funding for the New England PTTC is provided through SAMHSA, so the Substance Abuse and Mental Health Services Administration. Our cooperative agreement is there on the slide, and there's some other things on the slide that I won't read, but just to know that the opinions expressed in this 3-day institute are the view of the presenters and do not reflect the official position of DHHS or SAMHSA. And quickly about the New England PTTC, we're actually in our final year of our first cooperative agreement with SAMHSA. We did reapply for another 5 years of funding. We haven't heard yet if we have received that funding, but if everyone could just give us a collective kind of cross your fingers, good vibes into the universe, we would appreciate that. And the New England PTTC really does, as part of the PTTC network, make sure that we're translating prevention science into trainings and technical assistance products and resources that really guide you, the prevention workforce, into adopting and implementing prevention science in their communities. So as you all probably know at this point in our 6 years together, that includes webinars, online courses, sometimes in-person events. We also do a lot of resource development, which you will see just a small part of that with our RAD Fellowship Symposium today. And we also offer tailored intensive technical assistance, which we encourage all of you to reach out to us for. And we do much, much more beyond that. But if you'd like to find us online and check out our website, you could see kind of everything that we do and just a sampling of the products and trainings that we provide. This is the network coordinating office, the map of the PTTC network. We do have a coordinating office that is in the University of Missouri, Kansas City, and then you'll see other regional centers. that are on the map here, which might look a little different going into October of this year, since we're all reapplying for funding. And I also wanted to just remind everyone that the PTTC network uses affirming language to promote the application of evidence-based and culturally informed practices. We all know that words have power and language matters, so we strive to use person-first and identity-first language in all of the work that we do, and we encourage you to do the same. And here's our schedule at a glance. We are at day 1 today. Pretty soon, you're going to hear some welcome and opening remarks from Scott Gagnier, who is now our SAMHSA Region 1 Director. And then you'll take part in our amazing RAD Fellowship Symposium with just a powerhouse of a cohort this year who developed some products on workforce development. And then we have a really exciting afternoon with Dr. Frances Eberly, who's going to really talk to you about increasing your leadership and really looking into your motivations and the impact you make as a leader in the prevention field. We'll have time for questions throughout the sessions today and the 3 days, so don't worry about that. We will also have a GIPRA at the end of the 3 days that we will ask you to fill out, so don't do it yet. And of course, if you have any questions, here's my email and Sarah Harlow's email. You can connect with us at any point. We love to hear from you. And I'm realizing that I didn't introduce myself. My name's Erin Burnett. I am the new director of AdCare Educational Institute of Maine. I'm also the director of the New England PTTC. And I just want to welcome you all today. Thank you for being here. And before I turn the virtual stage over to Sarah Harlow, I just wanted to give her the biggest thank you that I have for really taking the initiative on this advanced institute when I became the director of AdCare. We're kind of juggling 2 different roles. Sarah's doing a lot more than she was previously. I'm doing a lot more since we're a staff member down in the PTTC. So I just want to extend my heartfelt gratitude to Sarah Harlow for really taking the initiative with this. I appreciate you and thank you so much. So with that, I am going to stop talking and hand it over to Sarah. Thank you.
Thanks, Erin. I don't know if I'll be able to share. I'm so flattered. Welcome, everybody. So we're going to get started with our 2024 Research and Design Fellowship Symposium, so we can hear from our RAD fellows for this year. As you can see, we have 5 senior fellows this year, which means those fellows have been a part of the program before, and we have 1 brand new fellow who we were very excited to welcome to the program, who created something very innovative that I'm excited to share with folks. But before we get started, we want to take a minute for who we still call our fearless leader, Scott Gagnier, to give a welcome. For those of you who don't know, Scott was on our team as our director at AdCare and at PTTC, and we're very excited now to have him at SAMHSA leading more than just us and leading the way there and spreading the prevention message. So Scott, really excited to have you here today and would be happy to hear some words of wisdom from you.
All right, I'm going to take over your screen here. Well, hello, everyone. Nice to see you all again from a slightly different chair here in rainy Boston this morning, joining you. Before I get going, wanted to echo Erin's sentiments for Sarah and Erin. As she talked, they're a person down. That's largely my fault for moving on here to SAMHSA, but just can't say how proud I am of both of them for really stepping up and leading things in this time of transition, and really congratulate them for this institute for the next 3 days. I remember when I was still there, when this idea came up and it was germinating and we talked about different pieces. I was really, really glad to see it in action. So my name is Scott Gagnier, now the Regional Director for Region 1 here at SAMHSA. Just want to provide a couple little remarks before we turn it over to the RAD Fellows. For anyone who may not be aware of SAMHSA and who we are, basically the major funder for substance use and mental health services for the country. through a lot of different grants, through our various centers. Here you can see our mission and our vision. So, our mission is to lead public health and service delivery efforts that promote mental health, prevent substance misuse, and provide treatments and supports to foster recovery while ensuring equitable access and better outcomes. And then our vision is that people affected by or at risk for mental health and substance use conditions receive care, thrive, and achieve well-being. So as I mentioned, I'm with the Region 1 office as regional director here. So we're one of 10 offices across the country. You'll see basically it's the same regions as the PTTC and the ATTC. So we follow the same regions. So I cover Region 1, the 6 New England states, and 10 tribal sovereign nations. So as far as what we do here in the regional office, our primary goals are to represent SAMHSA in the national, regional, state, and local communities and connect with behavioral health leaders and professionals, promote initiatives that advance behavioral health and engaging target populations, develop, support, and lead collaborative initiatives across the federal HHS and other federal agencies to assure behavioral health is a national priority, and to support the field through technical assistance, promoting program development, policy innovation, and system transformation. And so we're a team of 3 currently, although we're hiring, so we'll eventually be a team of 4. I'm joined on the team by 2 regional behavioral health advisors, Rachel Braze and Dr. Laura Grubb. If you haven't been able to meet them yet, I hope you will get to meet them soon. They're really great, helping me to cover the region across the spectrum of services. If you're not familiar with our strategic plan at SAMHSA, here is that, and you'll notice that right there in the bright red circle is preventing substance use and overdose. And I think one of the important roles we have as regional offices is to get feedback from the field. And this is a great example because the first iteration of the strategic plan for this next 3 or 4 years, that red circle was a little different. It was primarily overdose prevention. It didn't really integrate primary prevention. So through the great feedback that regional offices heard from the prevention field and other stakeholders, SAMHSA heard that loud and clear and made that change. So this is a nice example of how we, as regional offices, can be here to support you. If you ever had feedback on anything, whether it's SAMHSA grants or anything that SAMHSA does, definitely be in touch with us so we can be that voice for you. So one of the things I thought about when it came to this institute and what the RAD fellows worked on and whatnot is in knowing that many folks attending this institute or a few years into their career is, and this of course is something I've been thinking about a lot myself as I've gone through a career change, is having a vision for our prevention careers. And, certainly the vision I have now is not the same as when I started out many years ago. But I think this is something that on a personal level can kind of keep us engaged and help us figure out what is our goal? What are we doing in the field, and what are we seeking to achieve? And I've thought about this a lot recently, again, with my own career change. And what I landed on is for my own personal vision of my personal prevention career is that prevention professionals in our nation feel valued, supported, and empowered to do the work that supports their communities, but also to be in careers and jobs that bring them personal joy and fulfillment. And certainly as I was leaving ag care and PTTC, that was a large focus of our work in the prevention space, was through technical assistance, but through other initiatives, is to really support the field, not just to do the work, but to feel good while they're doing the work and to feel like they're making a difference and having impact. So even my change here to the regional office, this is still something that drives me. While I am now responsible for a spectrum of services, I do intend to have a strong prevention component to the work here in the regional office, primarily supporting the workforce. And so some important elements for me with that are things like having state support, having support from the federal government, mentorship and fellowship programs, leadership training. These are all important elements I think we need present to reach that goal of having individuals having fulfilling careers in prevention. So this is something I will continue to strive on in this role at SAMHSA. So I would invite you over the next 3 days to reflect upon your vision. Maybe you've not thought about it. Maybe you've not thought about what your own personal vision for your career for currently in the long term is. So I would have you think about that over the next 3 days. So what is guiding you as you make the decisions in your career, and what are you working towards? think about that and maybe even jot it down. And if you're willing, share with our PTTC team or even us here at the SAMHSA Region 1 office. I'm actually going to be at SAMHSA headquarters in September for some meetings, including with folks at CSAP. So I would love to share some of that with those folks. So if you're willing, please share those with me. I have my email address on the last slide. Finally, I do want to put a plug in for SAMHSA Prevention Day, which is February 3rd, National Harbor, Maryland. There's a call for presentations. Our abstracts out currently. They're due by September 4th. So if you have really cool initiative or program that you've been working on that you want to share with the rest of the country, please submit an abstract so we can see you in National Harbor in February. So here's my contact information. If you have any questions or anything we can do at the regional office to support you. And with that, I will turn it back over to Sarah.
Thank you, Scott. We're really glad to have you here today. And thank you for sharing that information with us. So I'm just going to talk a little bit about our fellowship program, but I'm going to do this really quickly because I want to give so much time to the fellows who did all of the hard work this year. So what our fellowship program is, it has two goals. And the first goal of the program is for these professionals who have been in the field for a while, who have done a lot of the 101 level training, which I'm sure many of the other folks in this room can relate to that feeling of wanting some new space to do professional development. So that is these 6 folks that you see here on your screen, 7 including our fellowship mentor, Dan. And the second goal of this program is to create new resources that benefit the field. And each year we choose a new priority subject area that all of the resources fall under that umbrella. That is a space that we have been getting a lot of requests from the field. It's an area that we are not seeing as much research as we would like to see specific to prevention. And it's something that folks are really needing more support and more resources on. So it really allows this program to be an innovative space to be able to focus on a new priority subject area each year. We do pay our fellows for being part of this program. That's really important to us to be able to offer a paid opportunity because, as many of you know, we often are asked to do things using our expertise that are not paid opportunities. So we wanted this space to be one that did pay these folks for their work and expertise. It also provides a connection between these fellows to one another, so they have a deep understanding of what one another's expertise is and who they can call on when they need those supports. And it's also an opportunity for these fellows to talk about their specific skills with the rest of the field. So we have 6 fellowships that are awarded per term, and this is our 4th term of this program. So we do have 6 resources in these 3 priority subject areas available to you on our website. So if you're interested in any of these priority subject areas, please visit our website and check out those resources as well. And as I mentioned, 5 of our fellows this year are senior fellows, which means they have 1, if not more, other resources that they developed. So if you find that you have a particular connection with somebody, or perhaps you're in the same state, or somebody has a kind of a theme to their research that you're seeing emerge, that you think that they would make a really great presenter or contractor or just connection for the work that you're doing, I encourage you to reach out to those folks. So this is just a quick structure so you can see how long these folks have been working together in this program. We started back in February, and then we have 4 meetings throughout the year so that they can touch base with one another and synchronize their research a little bit. And then we have our symposium in August. Every year we set our our goal to have the products available after the symposium, and every year so far we have been able to achieve having those resources available for the symposium, which means after today, at the end of today's session, we're going to give you the link. And I believe all of the resources are in there. You may see a little TBD if we're still working on loading things, but anything that's not in there now will be available by the end of the week. So with that, I'm going to turn it over to our fellowship mentor, Dan Fitzgerald. Dan was part of our first 2 terms of this program and has been serving as a mentor to the fellows last year and this year. We're really lucky to have you, Dan, and I'd love to have you share your experience as well.
Sure. Thank you, Sarah, and hello, beautiful people. I'm so excited to see such a great room here. Yeah, so my name is Dan Fitzgerald. I come from the small but mighty state of Rhode Island, and I have the honor of serving as our Research and Design Fellowship Mentor this year. And as Sarah mentioned, I had the opportunity to participate as a fellow in our first 2 cohorts. There's some screenshots of products I created my first year focused on queer inclusive programming and really centering the idea of using the strategic prevention framework as a way to really put forward that it's really an obligation to us as primary preventionists to work with and for the LGBTQ plus community and setting up the tools to do so. And then my second year, working off of a program I created in my local community on creating an alternative to suspension school-based program on cannabis prevention. So again, was able to create that through this program. And then both last year and this year have the really exciting opportunity to work as a mentor. And this came out of our kind of feedback survey at the end of each year where, you know, there's no, you know, right or wrong way to do this fellowship. There's such an exciting kind of breadth of products and ways we get there through research and design. So I have the opportunity to work alongside each of our fellows, and some folks that maybe just a few touch points, and others it's working alongside to process research and then assist with design. All I can say is I'm so excited that you all are here, because up right after me, you'll be hearing from all 6 of our fellows and seeing the really incredible products they have. And I encourage you to kind of jot down some questions. We'll have some opportunities to go out into some breakup rooms and hear from our fellows on these. And then please make sure you're staying to the end. We'll put the link to where you can download right away these products and start diving into them. And I know there's going to be some really excitement around each of those. Before we hand it off, my big pitch here is, if the PTTC is able to do this program again, I would really encourage the folks on this call to consider putting your hat in. For me, this was an opportunity to prioritize the time to kind of meet my professional expertise and my passion together, where a lot of us are so grant-based that we're not always able to dive into some of the work that we really see as maybe there's a gap we want to fill, or in my case with this program, something that we had been growing in our community, and I knew there could be some type of other use there. So I would just challenge everybody here is think about whatever those things might be. And it's, firsthand, it was an incredible program to go through, and I really would love to see some of the names here, hopefully going through that as well. So with that said, I will now, this is my email. If anybody's interested in products I made or learning more about the fellowships in general, please feel free to reach out. So with that said, I am going to hand it over to our senior fellow, Christina, from the Commonwealth of Massachusetts. Over to you, Christina.
Thank you, Dan. My name is Christina Mancebo Torres. I created a product that focuses on centering cultural and linguistic equity in behavioral health, specifically with the goal of increasing Hispanic and Latino representation in community-based prevention. Next slide, please. So just to give you a little bit of background, and really set the stage for why this in particular is the population of focus. Both this year and last year, I was a RAD fellow. My product last year was focused on adverse childhood experiences in the Hispanic and Latino community, and how working with the faith community can really benefit that population. Professionally, I am the co-founder and assistant director of a nonprofit organization called Centro de Ayuda y Esperanza Latina. That organization is headquartered in Massachusetts, but we also have sites in Orlando, Florida, Aguadilla, Puerto Rico, and La Romana, Dominican Republic. I am the president of the board of our site in the Dominican Republic as well. I'm the co-founder and co-director of a consulting agency called Blooming Consulting Services. Before that, I was a program specialist for the National Hispanic and Latino Prevention Technology Transfer Center. And I was a program director at the New Bedford Health Department. That's really where I got started in prevention. Next slide, please. I am a PhD student in trauma-informed care, which is why a lot of my work is focused on trauma in this population specifically. But I do have a master's in public health and graduate certificates in epidemiology and global health. Some achievements, I led my organization in a project that ended up being recognized by SAMHSA's Behavioral Health Equity Challenge in 2023. 10 agencies across the country were recognized, and we were recognized for our efforts in prevention specifically. We did create a Spanish language behavioral health training and fellowship program, which provides free training and paid fellowships in mental health, trauma, and substance misuse prevention or recovery. And one of my first projects with this population was leading the first Spanish language family-based opioid prevention program in Massachusetts. Next slide. So when we look at the behavioral health workforce, currently there are actually only 4 states that have the workforce capacity to meet more than half of the behavioral health need in their location. And those are in Utah, New York, New Hampshire, and Rhode Island. Massachusetts right now is meeting about 30 to 40%. But there is still a significant gap, even here in Massachusetts, which tends to be a leader when it comes to healthcare and behavioral health. But when we look at the states and territories with the lowest access, we look at places that have larger Hispanic and Latino, Black and African American, Asian, and Indigenous populations. And you can see on this slide, we're talking about places like Arizona, Delaware, Alaska, North Carolina, Hawaii, Puerto Rico, Missouri, West Virginia, and New Mexico. Next slide, please. And so part of the issue that we see, and this is really where this guide is really beneficial, is we don't understand culture and how it influences the way communities view things like trauma, mental health, and substance misuse. So when as agencies or as the people that are doing the hiring or implementing programs, if we have cultural ignorance, we're actually harming the communities that we serve. So we have to realize that culture defines what behaviors are considered normal. It also defines and influences what are considered valuable career paths. If a community believes that mental health issues are related to demonic influence, or that it's taboo, we don't associate with people that have these issues, and these are beliefs that are held by the Hispanic and Latino community a lot of the times. A lot of times people are not going to see that as a valuable career path because the taboo of, well, why are you helping them? They're crazy. Or why are you helping them? Those demons are gonna come to you now. And so there's a lot of myths that have to be debunked in culturally sensitive ways that because of our own organizational ignorance, we don't recognize that these things exist. And the organizational ignorance of culture can also create toxic work environments. It can hinder the increased cultural representation needed to reduce behavioral health disparities. And so these are things that we have to have an open mind to as we discuss and figure out You know, why is our field so white? We have a large white female presence in behavioral health. Well, why is that? And how is that hindering our ability to reach the populations that have these larger disparities? Next slide, please. So this guide, it really looks at a lot of these things. It does give the state of the behavioral health workforce as it is today. It looks at culture, the different Hispanic and Latino cultural values that impact how behavioral health is looked at. There are some study data included that talks about how different concepts like machismo, how it directly impacts behavioral health rates. And then it goes into some strategies that can be utilized to increase community-based prevention representation, and also how to build a bridge from that representation in the community to employment. There are some resources in there of different agencies that offer training and technical assistance. But what I have found is there are very few agencies that, if any at all, that are doing on the ground community level type training and technical assistance. Our agency does offer that. So in the guide, I do provide some information of how to contact us to request those services. But ultimately, there just isn't a lot that goes deeper beyond the kind of like knowledge building of practitioners. Next slide. And so I have provided my information here. If you are interested in discussing consulting or training or technical assistance, either email, you will reach me. I will not be able to stay today for a breakout session, but also if you have any questions at all, please feel free to reach out to me. I'm more than willing to discuss anything around this. And so now I'm going to turn it over to Michael. Thank you.
Good morning, everyone. I am very privileged and excited to be with you all here today. My name is Michael Awad, and I am representing the state of Connecticut as this year's RAD Fellow. Next slide. I am a licensed clinical psychologist. I was the prevention coordinator for the city of New Haven from 2018 to 2023. And during that time, I also served as the chair of the New Haven Prevention Council. When I joined it, it was quite inactive, almost defunct. And over the last 5 years, I was able to help revitalize it through very strategic community partnerships that continue today. One of the hallmarks of that experiences was developing an innovative mental health promotion and substance use prevention program. It's called One Step. It's still being implemented in New Haven public schools. And I also had the privilege of creating a product during the 2022 RAD fellowship cycle that was focused on leveraging social media for cannabis prevention. So you'll also find that on the New England PTTC website. I completed a 2-year policy fellowship at SAMHSA, which is sort of the seed for a lot of the work that I do today. It was housed in the Office of Behavioral Health Equity. And I completed a 3-year NIDA postdoctoral fellowship in substance abuse prevention at the Yale School of Medicine. And now I've pivoted more to focus on prevention science as a newly appointed faculty member at the Yale School of Medicine. And I share this trajectory because I want you to all be aware of the kind of career progression that one can have in the field of prevention, and how each kind of experience that you have can be a stepping stone that leads you to something bigger and something that can have greater impact within the field. Next slide. I'm very happy to introduce you to my product today. I bring a lot of my firsthand experiences as a burgeoning professional in the prevention field to my product. It's called Disarming Microaggressions and Macroaggressions to Promote a Diverse and Inclusive Prevention Workforce. But it's impossible to promote a diverse and inclusive workforce if we don't understand what these terms mean, especially in the socio-political climate we are in currently, where a lot of these terms have been weaponized, and there's a lot of public confusion about what diversity is and what it constitutes. Next slide. I want to bring your attention to this graphic, which I think is a really good starting point. I think it really captures the essence of what the terms diversity, equity, inclusion, and belonging are. So diversity is a fact. We are a nation of people with different cultural identities, values, experiences, and beliefs. Equity is a choice. How we choose to acknowledge this diversity in our individual and systemic interactions that respects this diversity is a choice. It's something that we have to decide to do. Inclusion is an action. So today, inviting preventionists from all levels and backgrounds to participate in the field to solve real world problems is why we are here. And lastly, belonging is an outcome. When we are inviting people and helping them feel like they are truly where they belong, where their skill set, where their talents are truly making a difference, that is the fruit of diversity, equity, and inclusion. And it means we've truly done our job. Next slide. So I believe that prevention is the foundation of diversity, equity, inclusion, and belonging. And I begin my product describing why this is the case. Because if we equitably invest in preventing problems for communities, then all communities fare better. Meaning if we equip all communities with the same access to prevention resources, while, and here's the caveat, while supporting the advancement of preventionists doing the selfless work. Think about the work that you do in your communities day in and day out that's not acknowledged, that is selfless, that is so effortful, but we don't really get to see or celebrate or acknowledge it. When we do get to celebrate, acknowledge, and reward it, then a community's geographic location or their demographic makeup really can't determine their outcomes. But like I said before, this is a choice. So we need more preventionists who understand and reflect the nuance of the communities that they serve. However, you probably know from firsthand experience that preventionists are leaving the field at record rates. And I argue that there are two main points that we have to address, and it's the foundation for this guide. First is that the work cultures and environments that we're in promote bias, and there are institutional practices and policies that inhibit the promotion of diverse workforces. And these 2 points can be encapsulated in scientific phenomena that have been studied and documented on the next slide. And those are microaggressions and macroaggressions. So microaggressions are the brief and commonplace daily verbal, behavioral, or environmental indignities, whether intentional or unintentional. They communicate hostile, derogatory, or negative slights, invalidations, insults towards an individual or groups of individuals because of their marginalized status in society. Macroaggressions, which are less known and less studied, but my program of research focuses on, are the more obvious over organizational and institutional-wide offenses and abusive acts evidenced in structures. They're far-reaching, they're broad-based, they're pervasive in scope, and they have impacts on larger groups of people. Next slide. So in the guide, I really give real world examples of how we see microaggressions rather, in prevention. There's different types of microaggressions. I share 2 examples here, and if any of these resonate with you, please include your comments in the chat. I would love to read these and love to involve you in future research. So an example of a microassault is sending brochures and materials to display during tabling events at certain schools in a district, but not sending actual staff to interact with the students at those tables. There's a communication there that is not always apparent, but when we look into the behaviors of the individuals, we can see that they're communicating these youths are dangerous and we don't want to put our staff at risk, so we'll just send literature that they can read on their own. An example of a micro invalidation is asking the sole Spanish-speaking team member to attend every event in a predominantly Spanish-speaking community without giving them ample background on what the intended goals or outcomes of the event are. I saw this time and time again. When the team member communicates, the only skill they feel senior staff recognize in them is translation services, they're told, come on, you know that's not true. So the meta communication there is that this team member has communicated their perceived lack of value by a senior staff member based on not being adequately prepped to participate in these events in a meaningful way. And when they share their feelings of invalidation, they're dismissed. Next slide. And here are some examples of macroaggressions that occur in prevention. We see this across many different domains, including funding, program development, program implementation, program evaluation. With funding, for example, while prevention is the most underfunded component of mental health care, I think Scott can speak to that. The reality is that some communities are actually more funded than others. And the meta communication there is that some communities are more important than others or are given higher priority based on unfair metrics. A macroaggression in program development is developing prevention programs that lack multicultural foundation that incorporates formative and iterative community input, involvement, and feedback. And the meta communication there is that your program models based on outdated theories are better equipped to address the distinct problems affecting today's people rather than soliciting their feedback and opinions on what might help. And again, I've seen this time and time again using manualized interventions that were developed decades ago, but don't fit into my community and don't really fit the needs that my community needs addressed. So what do we do about this? Next slide. There are micro interventions and macro interventions that we can use and deploy to actually dismantle these micro and macro aggressions. And this is where the rubber hits the road in this guide. It provides you with clear strategies and resources for how you can address these situations in your work. And I link to several articles that I've authored in peer-reviewed journals. I link to several textbooks that you can use in journal clubs or book clubs with your prevention communities. Next slide. And lastly, I provide guidance for promoting diversity, equity, inclusion, and belonging across the prevention career lattice. And I just list a few nuggets here of what that might look like. So in the recruiting process, attempting to recruit candidates that reflect the cultural nuance of the population you intend to work with and have impact on. With onboarding, providing staff with training opportunities at the onset to understand the nuance of the community, the science behind the practice. I often feel like we hire prevention specialists and we push them out into the community without really any knowledge or background on what prevention science is. And I think, you know, today is an example of how we can promote DEIB in the prevention field, having this Advanced Prevention Institute where you are learning the prevention science and you're not just sort of being slingshot into work where you don't really understand the background. In retention, providing opportunities to promote belongingness. And lastly, with promotion, investing in the next generation of preventionists by helping them further their education, contributing to the prevention knowledge base through innovative ideas and solutions, and involving them in scholarship and research so that they have a track record of their work. You think about the work that you do day in and day out. How's it being captured so that you can reflect it to employers so that you can advance your career? Next slide. So I would love to stay in touch with all of you. This is my emails, michael.awad@yale.edu. Please reach out for research collaborations, any community partnerships pertaining to the New Haven Prevention Council. We would love to interact with you and share our work and involve you in our work. So this is my email. I plan to do future research on how we see micro and macroaggressions in the field of prevention, and I would love to hear your experiences to capture those in our work. And last but not least, I have the honor of presenting my esteemed colleague from the state of Vermont, Mariah Flynn.
Thank you so much, Michael. Hi, everyone. I'm Mariah Flynn. I use she, her pronouns. I'm the RAD Fellow from Vermont, as Michael said. I'm a certified prevention specialist who's been working in the substance misuse field for more than 23 years. The last 16 of those have been as the director of the Burlington Partnership for a Healthy Community, which is a substance misuse prevention coalition serving Vermont's largest city, Burlington. And well, the organization I work for serves one city. We know that we probably all know how important it is to have unifying messages around prevention strategies and resources for our field. So I helped to start and I'm a part of a number of networks of individuals and organizations who meet at a county level and a regional level and state levels to bring attention to the public health needs of Vermonters. As part of those connections, I heard from others in the field of Vermont about a need for more support for new professionals in the field. In our state, we have quite a few dedicated people who've been working in substance use prevention for many, many years. However, as Michael alluded to, and probably a lot of you know, like many other states, Vermont's struggling to get new people to enter the field and to stay in the field, particularly people who reflect the cultures and experiences of the communities that we're serving in prevention. There is currently a work group in Vermont that's looking at how to get more people interested in entering the workforce. So I focused my project for this fellowship on learning more about what was needed to support folks who are already coming into the field. I did some assessment. I developed a survey to gather some information from the prevention professionals in Vermont. And one of the themes that came out of that was that supervisors needed more help to orient their staff to the work and to help them make them more comfortable as they learn the prevention science and more about our field, as Michael was talking about in his project, that being a piece of the work that we all need to do. Next slide. Oh, you can switch to the next slide. Yeah, thank you so much. So so for that reason, I started out just kind of pulling together some tools that I thought would make it easier for someone to learn the prevention field. But over time, it ended up developing into a guide for new professionals working in the field of prevention. I think the great thing about prevention is that between the PTTCs, CADCA, SAMHSA, and a lot of other great organizations supporting our field, there actually are a ton of really wonderful resources that have already been created to help understand those key concepts in prevention science, to help preventionists improve policies and practices and programs and environments that make it easier for people to thrive. But one of the things that I found is that the resources all live in different places. It can be hard to remember where to find things. And as you're entering the field, that can feel really overwhelming for folks. And it can be overwhelming for supervisors who are trying to organize that information for their staff as well. So really all I did in my guide was pull things together into one place that kind of organizes it all and helps you create a plan for it. So yeah, you can switch to the next slide. So probably the most important section of the guide is a timeline for the first year of training. It's broken down into 3-month phases with videos to watch, materials to read, and resources to get to know as someone new in the field. The timeline is just focused on learning about prevention science and the substance use field itself. So it doesn't include all the other orientation that you'll need to do to learn about your own organization and your own community, but it will help you kind of get the basics of understanding the work that will help you support those, support your community. So the timeline also includes questions at each phase that can help you reflect on what you're learning and connect it to the work of your own position. You can switch to the next slide. There's also a few other things in there, and I listed a couple of them, but folks will have to check it out to see all of it. There's other things that really align with what folks told me when I did that initial surveying, what would be helpful for their work. So I've included acronyms that folks are likely to hear in their first year of work. You'll see that in some of the other guides and toolkits that I linked to in this guide that there are other acronym lists out there. I kept this list short on purpose. I really wanted it to feel, for someone new in the field, this guide to not feel overwhelming. And so I really did try to hone in on just the things that were most relevant to what might come up for folks in their first year. I also included links to additional resources to learn about prevention science and newsletters to sign up for, to kind of keep up with common trends and things that are coming out in our field. There's also some additional tools in the appendix, something like a brief community scan, which is actually something that's encouraged as part of that timeline of learning that folks go out and do. The goal of that is really just to help get you out into the field as a new professional and get a chance to practice and see in person some of the things that you're learning about as you go through the timeline. Another thing, one really important reason I wanted to create this guide is to help standardize for our field a focus on diversity, equity, inclusion, and belonging. And that addressing health equity is an important part of the work from the moment someone is hired. So in the timeline, in the months 3 to 6, I think is where that this section is that there's a focus on increasing your knowledge and skills to recognize and communicate about health inequities. I also included a checklist of specific things that a new professional can do in their work to show that they have a commitment to furthering equity and accessibility. You can switch to the next slide. And the guide is not just for the new professional in the field, but also for their supervisor. So in the appendix, including in the supporting materials I mentioned, there's a section for supervisors. And the goal of that is to engage a new employee in thoughtful reflection about what they're learning. So in that, it's also broken into phases. And there's a summary of what they're learning in each section, and then some sample questions that you can ask about what the new professional is learning, just to help them have someone to process with. There's also a page in the supervisors section that encourages supervisors to be actively working on their own cultural competence and awareness of how to support the needs and experiences of all of their staff. I think Michael really did a great job of explaining why this is important. As you'll hear from many of my colleagues who are going to talk about their projects, our field has a lot of work to do to truly make everyone who comes into it feel valued and supported and heard. So in this guide, you'll see a link to a website where the PTTC has compiled a list of resources that help individuals understand the impact of culture on identity and prevention efforts. But one of the things that I found when doing research for this project, when I wanted to include this focus for supervisors on this section, is that there actually are not a lot of resources that are specific to the prevention field about supporting that same work we talk about doing DEI work in the community within our own organizations and with our own staff. So I actually think a lot of the fellows that are here doing this project, or that have been part of this fellowship, are actually very innovative in our field. And so I link to all of them in the supervisor's guide as well, and encourage you to read them to support your continued learning in this area, as I will be as myself reading all of them. You can switch to the next slide. Great. And so lastly, I just want to say, when I'm looking at resources out in the field and I want to use them in my work, there's often just a few things I want to tweak to make it work better for my community or for my staff. So I made this within the intention that you will change it. So when these projects become available, you'll see on the website that in addition to a printable version of this guide, I also tried to make it really easy for anyone who wants to use it to edit it and make it your own. So I included editable templates in both Canva and Google to allow supervisors to create their own versions. You can add in additional learning and resources that your own needs for your organization or your area. Because I started this project to support my field in Vermont, I also made a version for the Vermont prevention professional that includes additional resources and acronyms and links that are specific to Vermont, but there's also a general one just for everyone. And if you do like this resource and kind of how I put information together, you might want to check out some other things I've created. So I was lucky enough to be part of this fellowship program in previous years. And through that, I developed a toolkit to help support efforts to use policy to reduce cannabis use at the community level. So you can find that on the PTTC, the New England PTTC website. It includes slide decks that you can also use for community education and raising awareness that are also editable. So please feel free to reach out to me if you have any questions or you need these resources in a different format. I'm happy to help with that. I also want to give a really big thank you to the PTTC for continuing to provide this opportunity and for letting me be a part of it again. It was really wonderful to have this outlet to create projects that I'm passionate about. Selfishly, this is also a resource I need for my own organization. So now I can use it with my staff. And I'm really grateful to the other fellows in this program. I learned a lot this round about what's needed in our field to truly embrace and value diversity and grow as a professional. So now I'll pass it off to M. Delaney, the other fellow from Vermont, to tell you about their very creative project.
Hello, I'm M. Delaney. I'm the, I guess, junior Vermont fellow this year. So I've created a cooperative card game to fulfill the theme of this fellowship. And back in February, I had a perfectly normal product that was going to look perfectly normal and be unremarkable. And then a very dangerous thing happened, which was that I was given too much time in order to complete this. And so this is what you get, a not very normal resource. Next slide, please. So a little bit about me. I'm a Vermont certified prevention specialist. I also have the honor of serving on the Vermont CPS board. I have a master's in education and an MFA in interdisciplinary art, which was also an example of what happens when I'm given too much time. My professional experience has been mostly as a technical communicator, an information designer, a project coordinator for four very far too much exciting years. I also worked in collective management. I worked in nonprofits in Vermont for most of my career, and I'm very pleased to right now be working for Healthy Lamoille Valley in Vermont, which is a huge and very effortful prevention coalition. Next slide, please. So this resource is a cooperative card game that teaches the mechanics of equitable and inclusive meetings. And those are meetings where everyone is able to participate and everyone's participation is valued. Next slide. And I'm just going to share a couple of quotes that I found really helpful when I was doing a review of the literature on how to create equitable and inclusive meetings. This one really encapsulates why I decided to focus on meetings as a topic. Although no two meetings are the same, their collective impact on the culture is significant. Meetings matter. They are the forum where people come together to discuss ideas, make decisions, and be heard. Meetings are where culture forms, grows, and takes hold. And in prevention work, as I'm sure all of you know, we wind up spending a lot of time in meetings. Meetings are how we manage our projects, how we interact with the community, how we interact with fellow staff members. And I found this really insightful in terms of how interaction during meetings could form the culture of an organization and in turn impact how inclusive and equitable it is towards a diverse workforce. Next slide. And my focus was mostly on how to retain that diverse workforce. This is another quote that I found really meaningful. Problem-solving meetings are places where your organization really shows its values and its power dynamics and hierarchy. Setting the rules about how to work together is a key opportunity to disrupt inequity and foster inclusion. And this concept of having explicit rules in order to disrupt inequity is what led me to think of cooperative card games. I do play card games and board games quite a lot, and I'm often the person who is tasked with reading the manual and teaching other people what the rules are and remembering what the rules are. And this is sometimes very annoying to the other players because I will remember what the rules are and make people stick to them. And I thought that this would be a good opportunity to put that terrible superpower to a good use. Next slide. So this is the theme of the game is giving people the tools with which to engage in an inclusive and equitable meeting. This started out from the way that we generally use the word tools as just something that we can use to get something done. Then I started to think about actual tools, machinery, various ways of leveraging mechanics in order to make things happen. And so developed the theme of a set of literal tools that people can use. The card game is meant to be an experiential learning experience so that people are able to move beyond lists of tips and best practices for these types of meetings and really experience what it would be like to interact with other participants in this kind of meeting. And it's really intended as a teaching tool to be used in workshops, small group settings, probably team building exercises, and other ways that if we want to bypass kind of superficial, here's how you do things, and now let's forget about it type of experiences. Next slide. So here's an example of the gameplay. In a cooperative card game, because all the players are working together and they're not competing with each other, what they wind up doing is actually competing with the game. So the game presents various challenges, and then the players work together to solve those. In this situation, the game has thrown the players kind of a curveball, telling them the discussion is running into rough areas. What do they need to do about it? Next slide. And then this is more examples of how the game is going to continue to present challenges, obstacles. Next slide. But the players are all given the same cards to work with. So everyone receives a deck of cards, all the same tools, and they can approach these challenges together, all on a level playing field. There is room for discussion, but really the players are playing their cards in order to interact with each other. Next slide. And all the cards are designed to be interrelated, to play off of each other. So for instance, somebody could play the excavator card to really try to figure out what is going on with the situation. Another person could try to figure out how to solve it. A third person could see how this relates to other things that have been going on in the game. Next slide. And then it was really important to me to provide a way afterward for people to evaluate how the game had gone, if it's people who are going to play again, or just even as an exercise. I think it's really necessary to think about, how could this be played better? How could we have interacted better? Did everyone have enough time to play their cards? Did anyone feel left out? And think about making agreements for how to improve things in the future. Next slide. And that was my exciting first experience with this fellowship. I'm so grateful to have had the opportunity, so much love and support from the other fellows. It's just been a tremendously fulfilling experience for me. And even at times, if I, doubted whether people were sort of appreciating or maybe just going along with my crazy ideas, I really, loved having the professional support that came from this. Please feel free to contact me if you are interested in using this game, would like to see it adapted, or just want to talk about board games and card games. I'm very open to doing that. Thank you so much. And now I would love to introduce to you the senior fellow from New Hampshire, Alyssa.
Good morning, everyone. So I am Elisa Cannon. I am the New Hampshire Fellow, and I am currently the Executive Director of the New Hampshire Juvenile Court Diversion Network. A little bit about myself. I started in prevention work about 15 years ago. I worked in government agencies and schools, and also in community coalitions. I have a bachelor's in psychology, so understanding the human condition is what I really enjoy in life. All of our programs in the Juvenile Court Diversion Network, which we oversee the accreditation of and support for 17 juvenile court diversion programs across the state. They utilize expert screening, so that's screening, brief intervention, referral to treatment, the process for substance use and mental health with every single referred youth in order to provide interventions and prevention approaches. So all of our programs do utilize lots of substance use prevention in their programs. This is my second time as a fellow. I was actually the first New Hampshire fellow to start the program in 2021. And I, during that time, provided a resource specific to educators on ways to consider risk and protective factors for LGBTQIA+ students in their classrooms through their lesson plans, but also in their schools and their communities. Next slide, please. Thank you. So why this product? As a woman who identifies as a lesbian, there are many things that I have to consider as I've been looking for a job over the years. What is the culture of the organization or the business or the workplace? What are the current policies? What does health insurance consider? How comfortable would I feel sharing parts of my life with coworkers. As a nonprofit executive, I also, as Mariah mentioned earlier, selfishly wanted to ensure that my own organization is intentional about our own hiring practices and also the community that we create and how we do that across the state and all of our programs. So it is crucial that we as hiring professionals, as organization leaders, that we take the time to actually understand what our practices look like within our own organizations. And we should be fostering a supportive environment where LGBTQIA folks feel safe, feel valued, and incorporated. All of this leads to job satisfaction and retention. And I think that goes across the board. When a person or employee feels safe and included and valued in their organization, their business, they want to stay there. They want to keep doing the work, especially if they love it. This also strengthens the relationship and the organization as a whole, which leads to a more dynamic and successful business or organization. Just as a note, I did mention this in my product, but the U.S. Census noted in 2021, which is their last data set, or their newest data set, I should say, about 8.5% of adults in New Hampshire over the age of 18, excuse me, identify as LGBT. So we make up a significant portion of the workforce, and our organization should be providing the workplaces that do support us. Next slide, please. Excuse me. I would like to note a special relationship that I have between Seacoast Outright, which is a youth serving organization out of the seacoast of New Hampshire, and will eventually be moving to provide services for the state. They offer training and resources for workplaces, specifically for LGBTQIA issues, policies, things of that sort. And also the Affirming Spaces Project, also another agency who works with businesses to provide information about becoming an affirming space, specifically for transgender employees and clients. I reached out to them as part of this project to get their information, appreciative inquiries, if you will. And I wanted to make sure that I noted their participation in this project. And one of the things that I really appreciated was some of their comments, and I did include them in the product, but also I just want to highlight this real quick. So LGBTQIA+ applicants deserve a hiring process that is friendly and welcoming. We must be considered fairly and approached with empathy and understanding, just like everyone else. So those businesses and organizations who are not willing or who are not intentional about their inclusion leave a tremendous amount of talent on the table. Employees are more likely to stay with a company where they feel represented, valued, and seen. And then simple actions can make a significant impact. Some of these actions, which I noted in my product, include reflecting on what their current structure looks like. How are LGBTQIA folks represented in leadership? Is there a place where they know they can safely voice concerns and they'll be listened to and also taken seriously? Is there current, relevant, proactive training available for managers, supervisors, and other executives to ensure that all employees are aware of best practices and inclusivity for LGBTQIA folks? Every single person, regardless of their identity, brings a unique set of skills and experiences to the workplace. When LGBTQIA individuals feel safe, engaged, accepted, included, their job satisfaction increases significantly. Job satisfaction leads to job retention, as I noted earlier. Next slide, please. Another quote that I wanted to mention from the Affirming Spaces project is, those who choose to empower or to embrace and empower a group of employees with a wide variety of backgrounds and identities will enjoy the collective strengths and successes of their team and foster a more positive culture. Inclusion benefits both organizations and businesses and the employees. It's very simple, but it's also very profound. True inclusion, though, goes beyond just putting up a pride flag during June or hosting a pride event one time a year. Organizations have to be active and engage in and also engage LGBTQIA+ folks in the decision making, in the policy creation, in leadership positions, and also the training. Creating a welcome environment, as I noted. I can't say enough. I know I've said this numerous times, excuse me, but safety and the perception and the feeling of safety is extremely important. I need to know when I go into an organization or I apply for a job that I'm going to feel comfortable in that space. Also implementing and consistently adhering to non-discriminatory policies that explicitly protect LGBTQIA employees. Ensuring job descriptions and advertisements use inclusive language to show that they are a welcome and affirming space. And ensure the hiring and interviewing processes are appropriate and inclusive. Another way is providing training programs on diversity and inclusion and talking about unconscious bias and also equity in the hiring process, but also in leadership, management, supervision, promotion practices, things of that sort. And one thing above all that I encourage is the partnership with local LGBTQIA+ organizations. Their expertise, their lived experience, their community support and engagement can provide businesses and organizations with invaluable insight. They can provide best practices. They can provide diversity metric measurement, language use, and so many other support. Workplaces don't have to do this by themselves. There are plenty of resources available. Next slide, please. Thank you. First step for a workplace is to establish what they need. Looking at, I've listed a few options in the product, but also included New Hampshire resources like ASP, so the Affirming Spaces Project, and Seacoast Outright, as well as other New England resources. Another I wanted to point out is, because this is a prevention-focused organization, we have to consider the fact that those of us who work in prevention and understand prevention know that LGBTQIA youth are at greater risk and experience a significant increase in ACEs and trauma because of their identity. Those youth grow up to be working adults like us. So understanding that we don't leave those traumas, those ACEs, those needs as a youth, those come with us. So understanding that we as in an LGBTQIA person, also experience greater use of substances. We also have greater challenges for mental health. So looking at what is representation for our youth, if we're working in a youth serving organization, but what is our representation for those of us who are experiencing the same situations and live in the same community. So I also included the Recovery Friendly Workplace Initiative, which is a New Hampshire-based initiative, but they also can provide many prevention, treatment, and recovery supports, policies for businesses and organizations across the state of New Hampshire. Any business or organization should be reflecting on what they can provide, how intentional they are about integrating, not just including. So integration and inclusion are different, but integrating LGBTQIA+ and other marginalized populations into their workplace culture. What do their policies say? What are their health insurance covers? Are their policies exclusive of healthcare needs of transgender employees? So these resources for New Hampshire are just examples of organizations and businesses that businesses can look to for support. But in the product, you can also find some research and articles that include a more in-depth look at workplace inclusion for LGBTQIA+ folks. And I believe do I have my email next? Thank you. So thank you very much for offering me this opportunity. I have enjoyed it immensely, as I did the first time around. We have some great fellows in this cohort, and with wonderful products that all tend to play off of each other and support each other. And that is one of the things that I really have enjoyed about the fellowship program, is being able to mesh all of the things that we do together. So if you would like to reach out to me about either this or my first product, both inclusive of the LGBTQIA community, you can reach out to me at elisa@nhcorediversion.org. And I would like to pass it on to our other Massachusetts fellow, a senior fellow, FJ.
Thanks, Elisa. And thank you all for sticking with us. I'm going to bring it home for the group. I hope I can kind of meaningfully tie all of my colleagues' wonderful work together in my product and give you a sense of what you can expect if you kind of dig into my product. I know it's been long, so thanks for sticking with us. I hope you're taking care of yourself. I, for one, will have my camera off so that I can move around and take care of myself as best I can during this presentation, but I'll be in full view in the breakout session for everyone who joins me for that portion of the day. My name is FJ Perfas. I am coming to you from Boston, Massachusetts, the Commonwealth of Massachusetts. And I work at the Department of Public Health. I work in the Addictions Bureau in the prevention office. One caveat that I think that's important to mention is that the views here are not representative of the views or endorsement of my organization. These are my own views based on my experience of over 16 years in the field. So I am committed to this work. I've been in the same office for all of those years. I continue to be in that office. And during that time, I've worked up from intern to assistant director. So I have been able to kind of see and experience a lot of what we're talking about from very different positions within my own organization. And that's really informed what I've put together today. Before I dig into it, I just want to thank you first and foremost for choosing to be here. You could have been anywhere else today and right now, and you've chosen to be here. So thank you so much for that. And also for the PTTC. They continue to provide this wonderful opportunity and this wonderful space of creativity and curiosity that I just can't get enough of. This is my third term. So I also thank the PTTC for continuing to put up with me and my crazy ideas, or at least it seems when I set out to do them. I have been focused really on applying restorative practices to our field. There's so much in our work that I feel can benefit to just kind of reframing what we do, or at least taking a different approach than what we've seen in the past, and what we've seen isn't necessarily working in the way that we'd like it to, and that applies to workforce development. And so I'll get into that in just a bit. I also want to thank my cohort colleagues. It's their diverse perspectives and experiences that have really informed my work and contributed to my growth, both personally and professionally. So that's another reason why I keep coming back to this space. And I just want to echo Dan's encouragement to all of you to apply for the next cohort if we're lucky enough to have one. From my experience, this has really been such an expansive space of curiosity and creativity, and it's in a field that's traditionally been confined to a data-driven and evidence-based approach that has felt limiting at times. And I feel like the PTTC and My colleagues have really taken this brave step of acknowledging the limitations of that approach. So this feels like an intentional acknowledgement and promotion of kind of critical and more nuanced data, the wisdom of experience that everyone has brought into this space that I truly appreciate. And it's also been just kind of thinking about some of the things that Lisa and other folks have shared this morning. It's also been a space that's felt like a space of safety and inclusivity in meaningful ways that I don't often feel in my own organization. So this is really a wonderful space in so many different ways. And so I'll stop there. Suffice it to say, please apply. If any of this is interesting to you, it gets even more interesting when you're sort of in the weeds with all of the other wonderful folks that are sort of participating in this space. All right, so Sarah, could you go to the next slide? Thank you. So the topic this year was workforce development, recruiting, training, and retaining diverse professionals across the career lattice. I highlighted retaining diverse professionals because that's really what jumped out at me, and it really sort of begged a lot of questions that dictated this work that I did. And it really was, why are we struggling with both retention and diversity? I think a lot of this has already been set up by the colleagues who have you've already heard from this morning. And so just kind of taking a prevention approach to this, I really wanted to get to the root of this issue. And so I think that starts with asking a lot of different questions. And another question that I ask myself is, how is diversity being reflected in our current approach to workforce development? And how is workforce development connected to folks choosing to stay in our organizations and field at large or not? And so my experience over the last 16 or so years at the Department of Health has really kind of helped me kind of get a sense of at least some of the reasons why I feel we might be struggling in a lot of the ways that my colleagues have kind of illuminated and identified. This slide, I chose this picture intentionally because I feel like it really represents something that isn't just connected to, I think, this workforce development issue that I explored, but also just our field at large. And this is a sort of an art installation piece that was at a music festival that shows two people turned away from each other, but they're sort of their inner selves represented as children, reaching out to each other. And I think for me, what it really highlights is this connection. I feel like this disconnection is reflected in our society. It's a part of a lot of the public health issues that we're attempting to address and prevent. I also think it's really at the root of a lot of the struggles I've felt as it relates to my workplace environment, professional development. I think, this connection is exacerbated in many of our workplaces. I think an idea that sums it up well is this idea of leave your personal issues at the door. And I don't think we can truly separate our personal issues from our sort of professional selves as we're often required to do. And so I think what you're asking people to do is leave their essence at the door, leave the reasons why they, I think, contribute meaningfully to our work at the door. And I don't think that that's the intention, but I think that that's become the reality. And I think that intentional separation leaves a lot of us, particularly those with limited positional power, marginalized identities. I think Christina said this, feeling unseen, unheard, unsupported, and undignified. So who would want to stay in an environment like that if they feel that way? And who would be able to thrive, let alone grow in that type of an environment? And so that's kind of a tension that has existed for me for some time now. And I think you see a lot of this reflected by the other products that my colleagues have presented to you today. There's a diversity in perspective and approach, not currently reflected in workforce development right now as it's currently being implemented. I mean, I think about M's product. What a wonderful way to think about how we can be more inclusive in our meetings, how we can make our meeting spaces feel inclusive and meaningful as in the form of a game. I don't know about you, but I could never see this right now, at least, being a part of our workforce development. So what a creative way of attempting to do that. And so I think I also go back to what Scott said earlier. How are our workplaces currently lacking in personal joy and fulfillment? I think feeling good about ourselves and our work is really important. And so how does our development within our workplaces support that. And so that's what I set out to explore in my product, and I offer some personal and professional insights in the guide that I created. And so, Sarah, you can go to the next slide, please. And so I created what I'm calling a dialogue guide called Putting the Human Back into Human Services. So embracing a more holistic approach to workforce development in the field of prevention. And so, I think there's a certain humanity that we've lost in the way we're approaching our work. And in this case, workforce development. So the holistic piece to this is really integrating personal support. How are we sort of integrating personal growth back into professional growth or professional development? And so I call this a dialogue guide because this is not an exhaustive list of things. And in fact, these are many things that folks are already aware of, have probably talked about or explored themselves. And so my hope is that this kind of starts a conversation among folks. It is a long, I go into a deeper dive on this in the product, but that's intentional because I want people to be able to just start at any place that they feel ready to within the document, and at least begin talking about this with their staff. So the goal really is to redefine workforce development as it's traditionally understood. And I really highlight the transformative potential of integrating personal growth into our workforce development approach. And it's that connection between personal growth and professional development that I feel can create an organizational foundation that more meaningfully fosters holistic growth of all of us. And so my hope is that we can better honor and support the people that comprise our workforce as a whole person and not just personnel. And this resource is crafted for any organization, really, any organization that's committed to embracing holistic, dignified, and relationship-centered approach to nurturing growth and development of the people of their workforce. And if I'm lucky, some of these, some of what I offer becomes standardized practices across our prevention systems, organizations, and staff development frameworks, which I feel will result in a more richly diverse workforce of prevention professionals across our career lattice. And so next slide, Sarah. Just to go through quickly what I've incorporated into this discussion guide or this dialogue guide, I think it's really important to acknowledge and address the historical context and traumas that are not just at the root of our public health issues, like addiction and substance misuse, but also how they connect to our current workplace cultures as a lot of us are currently experiencing them. And so, just acknowledging and examining systems of priority and privilege that have created societal and workplace norms that favor some staff over others and create a hierarchy primarily on the basis of gender, sexual orientation, and race and ethnicity. I think this is currently reflected in our workforce, particularly with those who stay and move up the ladder and those who don't and leave our organizations and maybe our field altogether. And so as I examine the current culture within this dialogue guide, I talk about the importance of building trust and why it matters, reframing tension and conflict as opportunities for growth, and shifting our workplaces from transactional places to relational places. So those are a few things that I talk about related to historical context. Next slide, Sarah. And my vision and hope is to reshape our organizational environments and really sort of support this organizational transformation through a focus on personal growth. Now, I think it's important to think or create a space that is more than just about productivity and feel more vibrant centers of connectivity to each other, to our work, and create a workplace that really nurtures holistic growth and allows all of us to develop into our fullest potential. I think if we prioritize our personal growth, we'll see a lot of that being reflected in the type of work we do. And I think that'll resonate with the communities and individuals we serve and support and really foster this collective flourishing, fulfillment, and well-being. Next slide, please. And so my approach really is through a dynamic and relational process that focuses or emphasizes on self-examination, reflection, curiosity, and creativity. Really centering the humanity of our personnel. And the ideas and practices that I suggest in this guide, I feel offer a potential pathway to a healthier workplace, a more effective workplace, all by emphasizing relationships, practice, and personal growth. Oh, that's my timer, and I'm going to finish up in just a minute. The way I do that are by sort of call out boxes within my dialogue guide. Point of significance, point of tension, point of practice are those call out boxes. And it offers, and so those kind of offer different ways of understanding more completely or more deeply some of the issues that we're facing in our workplaces, some of the tensions that are at the heart of it, and different practices that we might employ. And so different starting points that I've included are fostering holistic growth, creating supportive and inclusive organizational cultures through trust, authenticity, and integrity, and self-care being the centerpiece of all this. And so the last slide is really just a call to action. And you can, yep, there it is. And so I think together we can build workplaces that inspire, connect, and transform, where all of us can reach our fullest potential and contribute to a thriving and dynamic world. And that is all from me. I think I've included, if I haven't included my personal information, I can do, oh, there it is. So you can reach out to me either through my personal email or my professional email. And with that, I will pass it back to Sarah.
Thank you, FJ. So we have just a few minutes. So the first thing we're going to do is give you all access to these wonderful products. I saw folks asking in the beginning if they could access these products. We wanted to wait till the end so that everyone could share their piece individually before we give you the link to view all of these resources together. And we're going to put this in the chat as well so that you can easily access all of these wonderful resources. We also will bring these resources with us. So anytime the PTTC goes to a live event, we have many of these resources with us. So if you wanted a printed copy of anything, you can get those from us live and in person, or feel free to reach out to myself or Aaron or Chris and Erickson on our team, and we will be happy to get you some of those resources in person. So we have just a few minutes now. What we'd like to do is have a quick one-to-one breakout session. We want to do this because we recognize that some people are going to connect more specifically with one resource or another. So we want to give you some time to jump in a breakout room with the fellow who you perhaps connected with more closely, or their topic, or something about what they said resonated with you. So this is just to give everyone an opportunity to have a little bit more of a one-on-one. We're going to be in these breakout rooms for about 5 to 7 minutes, and then we'll bring it back here. If anyone has anything they want to share out to the whole group, we'll do that then. Otherwise, we are going to then take a quick break before we move on to our second half of today's session in the afternoon. So I'm going to ask my colleague Kristen to open those breakout rooms, and you should be able to select the breakout room you want to go in. So think about those resources you just saw and which fellows you'd like to connect more closely with. And this is your opportunity to do that. A couple of our fellows are not able to join for this session, but please still feel free to reach out, or if you maybe connect with one and don't have a chance to connect with somebody else, feel free to reach out to those folks after today's session. I'm sure they would all be happy to work with you and do a more deep dive into the research they've done. So Kristen, if you want to go ahead and open those rooms, if anyone struggles to figure out how to select their breakout room and join the one they want to go into, please let us know. But otherwise, we'll hop in there.
Yeah, I just opened up the room, so you should see an option to join those rooms. If you don't, let us know in the chat and I can put you in there. And if you're having trouble, if you don't see something popping up on your screen, but you do see a icon for breakout rooms on the Zoom toolbar, if you click on that, it should bring up the options for you to find the rooms and join them. I think that's usually how it works.
Thanks, Kristen.
It looks like people are getting into the room, so we're off to a good start.
gonna
I
poke.
wanted to do that.
Sarah, the products aren't on the page yet. Is that intentional?
They should be.
I don't know if I have the wrong link then.
Okay. I am going to stop my share and I will say welcome back to folks as they are coming in. Welcome back, folks, as you are rejoining us from your quick breakout session. Every year we do this symposium. We always say there's not enough time. We wish there was more time. You know, we love to hear all of the fellows speak about the work they've done. And so this year we had more time, and still it's never enough time. So I want to invite folks, we just have a couple of minutes. If you had any big aha moments, any new thing that you learned, especially fellows, if you were asked any really juicy questions in those breakout rooms, please let us know in this shared space we have together here in the next couple of minutes. So please feel free to unmute and share that.
Sarah, I'll jump out and just I'll just say that, within my space, certainly it felt like time that was not enough to sort of talk about the products, but it was a wonderful time to just at least see faces of folks who were interested in the product. And so I guess what I would say is that a lot of the questions are just kind of related to where do we start? What do we do with all this? And so I would just encourage folks to really take advantage of how open everyone is to just connecting with folks to talk more about their product. And so I would invite anyone interested in my product to just reach out, and I'm happy, and I would imagine my other colleagues would be happy to have kind of a one-on-one conversation with folks about their product to talk more about how they might implement it or sort of navigate any sort of questions that they might still have.
Thanks, FJ. I think that's a really good place to close out today for this morning session. We did put the link to the products in the chat. There are a couple that will be coming by the end of the week. So if you see on there the product that you really loved, it's not available for download yet, never fear. It will be by the end of the week. We're just in the process of getting those up onto the site. And please feel free to reach out to us too if you have questions about the program, or you missed somebody's email address who you really wanted to connect with, or you're interested in applying for the program in a future year. Please feel free to reach out to us or any of the fellows who shared their contact information with you today. With that, we've got about 5 minutes that we're just going to have a break. If you are only joining us for the RAD Symposium and you did not want to stay for the rest of our Advanced Leadership series, then you can feel free to log off now. Otherwise, if you're staying with us for the rest of the day or for the next 2 hours, please feel free to just turn off your camera and take a quick break. And we'll be back in about 5 minutes for the second half of our day 1. Thank you, everyone, and a huge thank you to our fellows.